Vivian Zapanta. I would like to discuss to you today the lower back. A lot of people wake up with gnawing pain in their lower back. And let's have a look why it is so. Alright, so if you notice, I put a platform on my feet because if I don't and I roll back like this, my feet will not touch the floor. So when you're following me, see, if your feet cannot touch the floor, when you roll back, you're lifting your heel. And if you don't have balance, you can fall off. So it's best to put a platform so that you are connected to the floor to make it a closed chain. Closed chain is when your feet are on a surface, on the floor, or an equipment. So, talking about back pain, what causes that? So many things. First is an imbalance of the muscles. If your lumbar, your lower back muscles are very tight, it can compress the intervertebral disc in between, okay? So, also, if you have very tight hip flexor, it pulls your pelvis forward so that your lumbar is hyperextended. So what we're going to do is to imagine the hip, the pelvis, as a wheel, okay? It's a circle. We're going to roll that pelvis away. So do you imagine that wheel? And then come back in. Got it? That will facilitate the rolling back instead of hinging back this way. When you hinge back from the hip, you're not opening the lumbar. You're even making it worse by tightening it. So keep that imagination focused. We're going to roll back, see that? And roll back in. You can even touch your pelvis. As you roll back, you're spinning your pelvis backward and you're spinning your pelvis up. And when you do this the second time around, try and feel what's happening to your lumbar spine. You're going to exhale as you roll back. There you go. So you feel a length in your lumbar spine, including your hip flexor. And then you inhale and you lengthen. So you just got to know how the breath goes in flexing and extending the spine. Every time we lengthen the spine, it's best to inhale because the spinal column is naturally extending. And the spinal column is naturally flexing as you roll back. Inhale, extension. Exhale to flexion. By doing that, you will see that it can give you a relief on the lumbar spine. But then again, if your lumbar spine is not that flexible, you can tap it first, okay? Tap the muscle surrounding the bun and the lower back and to induce flow of the interstitial fluids of your skin, your tissues, as well as your fascia. All right, so I would like to make you notice when you're in this position, you are in a posterior pelvic tuck, right? And your lumbar spine is in flexion or maybe super flex or even flat and come back up. So this movement is very, very nice feeling. Yeah? It gives you a nice feeling and you will even feel the muscles of your abdominals shortening and the muscles of your glute tightening, all right, and up. So that is a very good solution to people who are hyperextended in their lumbar. Many say they're so lordotic. But what about people who are stuck in this position, okay, in the posterior pelvic tuck? Okay, I'm going to stand up. I'm going to show you what I mean. All right. If your posture, okay, is wherein the pelvis is tucked forward and you're staying there, your weight is in your heels. So your lot of weight is in your hamstrings. and you are kind of kyphotic like this. Maybe forward a little bit or backward, that's the sway back, and this is kyphotic, kyphotic, or rather a sway backwards posture. Okay? So when you're stuck like this, 24/7, what do you expect? You will have low back pain. Why? Because you are programming your muscles of the lower back to be in a long position all the time, including your hips. So they lose their strength. That's why we also want to mobilize the hip joint, okay? And then roll it back up. So many people that are in posterior tilt also loves to sit down in a slouch position. Are you a person that slouch all the time when you watch TV? This is promoting a very bad posture. You see, what you're using to flex your hip is your lumbar spine and not the hip flexor. When you have to flex, you need to use your hips. On the other hand, so the weight of your sit bone are in the front. So your pelvic floor in the back is small and tight, and your pelvic floor in front is wide, and then you come back up. This posture of sitting up tall and vertical is the best posture for you to stay at. This is where you should be in almost all the time. But of course, we are pliable, we are flexible, we need to move our joints, we need to allow the fluids of our body to flow. Once we do not allow the fluids of our body to flow, we cause inflammation, therefore we invite pain, we invite injury. Do you want that? So all you have to do is just to sit down like this, watch me, put your hands like this, and inhale to lengthen, exhale, roll back. Inhale, stay here, and exhale up. If you notice, I changed my breath. I always exhale for beginners. I always use exhale when I'm moving, so I will wrap my belly. When I wrap my belly, I have more stability. Inhale, lengthen. Exhale, let the belly button drop in. Push your pubic bone forward. Inhale, stay, and exhale out. When you're already very good at this, you can exhale. Inhale. Follow the rule of the breath. That is, if your body is already strong enough. Otherwise, you can always alter your breath. And up. So that's our tip for today, and I hope you like that. I'll see you next time. Ciao!